Okay, we're going to do the posterior muscles of little man or mini man here. And we are not going to be covering the forearm muscles on this model because they're quite small on this model and they're best looked at on the larger arm and forearm model. So what we're going to do, we just want to get a look at the most visible muscles here. And so we're going to start at the top. And we'll kind of move down through the torso. We'll hit some of the shoulder and arm muscles. And then we'll move back through the gluteal area to the thigh and the leg. Okay? And we're just going to hit the ones that we can see best here. So you're looking at the posterior head, and you can see the back side of the muscle that extends over the very top of the head to go to the forehead. So this is called occipitofrontalis, or you can call it epicranius. And if you can see the little bit of temporalis peeking out over here, that is a muscle that is just superior to the ear. Okay, let's get into the posterior neck and back muscles here. So the first thing is you need to know what you're looking at. When you look at the right side of this model, they're trying to show you the most superficial muscles that you would be able to see if you just remove the skin. On the left side, what they've done is they've removed the most superficial muscles, so they've cut more deeply so that you can see some of the muscles that are deeper and sort of like inside of the back, okay? So let's start in the neck region. There is a very large muscle that extends from the neck, goes all the way over to the shoulder, and comes all the way down really to the middle of the back. And you can imagine if this is on both sides, it's sort of a diamond shape or a trapezoid shape. And so this is called trapezius. Trapezius is a superficial neck, shoulder, and back muscle. Okay. Let's move to the other large superficial back muscle right here. This is called latissimus dorsi. Latissimus means broad and dorsi means dorsal. So this is just a broad back muscle. Kind of goes from the axillary region, armpit region, and extends throughout the lower and middle back. Okay, let's hit the shoulder regions here. The large shoulder muscle that's superficial is the deltoid. Okay, and when you remove, actually you don't even need to remove it to see this here. Hopefully you can see the spine of the scapula here pretty well. So just superior to that, you can see the supraspinatus muscle. Over on this side, that is going to be covered by trapezius here. Okay, but here's supraspinatus peeking out. If you are inferior to the spine of the scapula, this is infraspinatus. On the arm, I just want to point this out here. You can see the posterior side of the arm, which is triceps brachii. You can see that pretty well. Also peeking out up here is biceps brachii and brachialis. Okay, you need to know rhomboid major. So once again, to orient you on this side, the superficial muscles have been cut away. Rhomboid major is a deeper muscle in the back. Okay, so this is rhomboid major. Let's move down here. And now we are into the gluteal region. You have two gluteal, and these are powerful. You have two gluteal muscles that you need to know. The largest one, the big butt muscle, is gluteus maximus. But a little bit deep to that and peeking out, it sort of looks fan-shaped. That is gluteus medius. Okay, so the big one is gluteus maximus, and you also have to know gluteus medius. Let's go to the posterior thigh. You've got the hamstring muscles. This is a group of 3 muscles, and 2 of them can be tricky, especially on the models. So I always tell everybody to look for the most lateral of the 3 hamstrings. That's this one right here. This is biceps femoris. So you get that one out of the way. The most lateral is biceps femoris. And then what you're left with for the hamstrings are 2 that are very close together. One of them is semitendinosus and the other one is semimembranosus. When you look at the spelling of those 2 words, only one of those words has an M in it, semimembranosus. M stands for medial. So of these 2 muscles, the one that is most medial is semimembranosus, and then of the 3 hamstrings, the one that's left in between is semitendinosus. So once again, most lateral, biceps femoris, most medial, semimembranosus, and the one in between, semitendinosus. You can also see gracilis, the inner thigh muscle, peeking out here. So you'll need to know that one. And you can see vastus lateralis peeking out as well. Vastus lateralis, which is a very big muscle. Let's move down to the leg. Remember, the leg is between the knee and the ankle. You have two posterior leg muscles that you need to know. The first one is the most superficial calf muscle. This is called gastrocnemius. Gastrocnemius. Gastro means belly or stomach, and it's named because it's got two large bellies. One is medial and one is lateral. Notice that gastrocnemius extends through its tendon to the Achilles tendon. That Achilles tendon is shared with one other muscle that you need to know that makes up the calf, and it's kind of underneath this connective tissue, and it's also underneath gastrocnemius. It's very large though, and it peeks out on both the lateral and medial sides. This is called soleus. Soleus. And on the side of the leg, if you can see this, you have fibularis longus. Fibularis longus. Okay, Jason, I'm done.
Awesome. I'm sending Craig my comments on your lecture at your labs today on my in-depth, thorough laboratory.
You know what? The only one I didn't do that I'm realizing now, and let me know what you think. I did not point out external oblique here.
Oh, who cares? That's fine.
Okay.
They're not going to get that view, and I'm not going to ask them for that anyway.
Okay.
So that's perfectly fine.